Hi, I'm Emily Rosenberg from BMB. I recently sat down with Dr. Heather Butts. She's a health law professor at LIU. We shared some laughs, cried a little, learned a few things on the way. Anyway, here's the full interview, unedited and uncut. I hope you enjoy. Absolutely appreciate it so much. I didn't really expect you to say yes.
Thanks so much. I really appreciate it. So now, are we taping now?
Yeah, we're taping. Yeah. So basically, I'm just gonna be asking you a few questions on a multitude of things. And then it will be put. I will send you the video if you want when it's over. If you would like to see yourself. But yeah. I mean, I just really appreciate you doing this.
It is my pleasure. I appreciate you asking me. So,
Okay.
goes both ways.
Okay. Cool. Then let's begin.
Okay.
So what do the reopenings of states mean in terms of the law?
Okay. So basically, the concern about states reopening too soon or too fast is that the infection rates for a particular state will go up. Now, the United States fought a war about 150 years ago called the Civil War. And out of that, we became a new nation with a federal government and state governments. Now, I think young people, interestingly enough, get this a lot more than people in my generation because I think you're a lot closer to things like civics and government than old folks like me. So if you know anything about civics and you know anything about sort of how the government works, you know that the federal government, which is made up of the executive branch, the judiciary, you know, Congress, Senate, um, that part of the government functions separately yet in concert with the state governments. So you have the states with their governors, and I like it almost more so to Europe, right? So you have Europe with these individual countries and they all function autonomously, but they're right on top of each other. So, so goes what happens in Italy is going to impact its neighbors, Switzerland and Germany. And so really, just like in Europe, where if one country does something that's different than another country, in this country, if one state does something different than another state, it's going to have a huge impact. So a good example is Georgia, right? So Georgia has opened earlier than some other states, and we will see what that means. But one thing that we should keep an eye on is, do the infection rates in Georgia go up because their policy and their laws of opening up sooner than their surrounding neighbors are different? There's an interesting legal concept called an attractive nuisance, and Governor Cuomo keeps referencing it, and it's worth noting here. Essentially what that is, and I liken it to, if your neighbor has a jungle gym but it's rusty and you have a child and the child goes to play on a jungle gym and they get hurt because it's rusty, that's an attractive nuisance. So it looks good to the little child, they go to play with it, but then they get hurt. That's potentially what we're looking at if states open and their surrounding states don't. You have somebody in New Jersey who's sitting there and they've been in their house for 2 months, and then all of a sudden the Madison Square Garden opens. I mean, what is somebody in New Jersey going to do? They're going to rush over the border to go see, Billy Joel in concert. So that's a concern, is that neighboring states work together. And if they're going to open, much like what New York and New Jersey have done, they create a consortium and they do it in a controlled, thoughtful manner.
Mhm. Okay. What do you think this will do to healthcare system to the health blah, blah, blah. What do you think this will do to the healthcare systems in these states that are opening up?
So the concern is that if you have states that open up and their hospitals are overwhelmed by patients, that this will basically tip the scale. And that's the reason why we keep talking about flattening the curve. The real reason we want to flatten the curve, well, obviously the real reason we want to flatten the curve is because we don't want people to get sick. But a secondary reason, but it's not so secondary, is that if we have a spike in cases, right? So if we have people who end up coming to the hospital with COVID-19 and they come to the hospital in droves and they're very ill, then it will overwhelm the hospital system. The hospital will not be able to function. And essentially, you will either have to turn people away, or you will have a scenario where the hospitals will be completely overloaded and people won't get the care that they need. So flattening the curve is very important so that we don't have hospitals that are completely overwhelmed like what happened in Italy. So if you have a scenario where a state opens too soon and they start to get more and more COVID cases, people start to come into the hospital, they're very sick, and then the hospital becomes overwhelmed and you have hospital workers start to get ill because the hospital is overwhelmed, that becomes an impossible situation. And then you can't possibly care for all these people because the hospital system is overwhelmed, and it becomes essentially a downward spiral of inability to care for people. People become more sick. People stay at home because they can't get into the hospital. They become sick, and then they spread it to their families, and it just grows exponentially.
Um, what do you think the timeline of opening up will be for New York?
I can actually tell you exactly what it is. So, I have my trusty little book. Oh yeah, this is my trusty book. Oh, this is my COVID-19 book. This is book 2 of COVID-19 books, and every day I take notes about. So these are my notes from today about COVID-19 from press conferences and so forth. So the timeline for New York is it's basically 4 phases. So phase 1 so just to backtrack for a second. New York, as of May 15th, is out of pause. So New York is currently in something called pause, and it's an acronym. And essentially what pause is, and it started way back in March, is a way, I don't like to call it a lockdown. It sounds so sad. Let's call it pause, because that's what the name of it is. And so what pause is doing is essentially, it's just putting a pause on pretty much everything that we do in the city, where we go to eat, our businesses, where we go to work. It's put a pause on that. So that started in March. May 15th, and it was extended by Governor Cuomo for several months. Well, pause, as we know it, ends on May 15th. Now, you may ask, because you are very bright, well, what will happen then? Well, once pause ends, we will go through essentially a four phase process in order to formally end pause. Now, in order to get out of pause, this is going to be a region by region scenario in each region in New York. You have to meet 7 metrics. First, you have to have a 14-day decline in hospitalizations, a 14-day decline in hospital deaths. New hospitalizations have to be at a very low level. You have to have a share of total beds available at a threshold of 30%. That's the question you were asking, by the way, in terms of hospitalization. So basically, you have to have a 30% capacity or a buffer for hospital beds. You have to they just have to be available. You also have a 30% buffer for ICU beds specifically. You have to have a ratio of 30 people per 1,000 residents tested on a monthly basis. Most places have that. And finally, you have to be able to have 30 contact tracers for 100,000 people. We definitely have that. All right, so that's the 7 criteria you have to meet region by region in New York. So for example, the Finger Lakes has done that. They met it, 7 out of 7. So as of Friday, they come out of pause. Phase 1 of that is you get to go back to construction, manufacturing, wholesale, supply chain, retail, curbside, agriculture, forestry, and fishing. Okay, that's phase 1. And there's 4 phases. The last phase is the one people are probably most excited about: arts, entertainment, recreation, and education. But within each phase, according to Governor Cuomo, there's going to be at least a 2-week pause on each of those phases. Because since COVID-19 takes anywhere from 2 to 14 days to manifest, you want to give a good 14 days to see, have we had an increase in cases between phase 1 and phase 2? So if you do the math, by the time most places get to phase 4, we're well into the summer at least, or at best. So that's going to be the timeline. But May 15th starts us on that trajectory with certain specific regions in New York.
Okay, cool. How do stay-at-home orders work? How are they legal?
Okay, what's a great question. So there's a case called Jacobson v. Massachusetts, and it's an old-timey case. It's, and I mean old-timey. It is it started in 1897, and the actual case is a Supreme Court case. It's a 1905 case. And essentially, that case involved a man whose name was shockingly Jacobson. And it was during the smallpox epidemic, and it was in Cambridge, Massachusetts. And so Jacobson basically said, I do not want to get vaccinated for smallpox. And the good people of Cambridge, the government in Cambridge said, oh, Jacobson, no, you need to get vaccinated. And he said no. And he was fined $5, which I know in modern times doesn't seem like a lot of money, but in the 1890s, early 1900s, $5 was not an insignificant amount of money. So he was fined $5 because he did not comply with this order. Now, the question that case asks is, do your civil liberties trump the rights of others to be safe, or do the rights of others to be safe get subsumed to your civil liberties? And that question said, well, it's a little bit of a mixed bag. If your civil liberties are such that they will put those in danger, and having smallpox is going to put some people in danger, then your civil liberties may have to be curtailed, okay? But if we curtail your civil liberties so much that you're just unable to sort of freely live your life, then that's an overreach. It's too much. So that case basically said, yes, Cambridge, Massachusetts could say, Jacobson, you have to pay a fine. They actually didn't force him to get the vaccination. They just said you have to pay a fine because you're not getting it. And that case is basically the grandfather and grandmother of all these cases that basically say, can the government put certain orders in place, like keeping you at home, like I'm not allowing you to fly, like saying that you shouldn't go to work, saying you can't go to basketball games? And the answer is absolutely they can.
Okay, that's really interesting, and it's nice to know that anti-vaxxers have not stopped since then.
Stronger than ever.
Oh God.
Exercising their civil liberties.
Okay.
Haven't stopped. Nope.
What do you think the coronavirus will do to change the laws in this country?
I mean, it already has. It's a great question. A lot of the ways that we're staying at home aren't because there's lots of legislators sitting around in, their offices or sitting around in big spaces making the laws. They can't. So a lot of this is happening by executive order at the federal level, executive order at the state level. And Governor Cuomo and Governor Murphy and a lot of our surrounding governors have passed laws very quickly to do that. The pause law that I mentioned is an executive order. There's something else called Matilda's Law that was passed in New York that's named after Governor Cuomo's mother. And that was an executive order as well. It refers to safeties that are in place for vulnerable populations and people over the age of 70. So your question is great. In the short term, COVID-19, the coronavirus, has already changed laws. In the longer term, I suspect there will be more changes in terms of freedom of movement, in terms of privacy, in terms of being able to test where people have gone, maybe more stringency around vaccination. So these are all things that, for better or worse, will probably have the government more involved in our safety. And the government's interested in that because, from a governmental perspective, it's important to keep people safe. And so that's essentially why we are a very important reason why we have the government.
Thanks. Actually two more questions, but as someone who has been in the health law field, healthcare field for some time,
Mhm.
what do you think the biggest effect the coronavirus will have on the country as a whole? Not just like laws, but like just in general.
Well, I'm an optimist, so I actually hope the biggest effect it has on the country as a whole is a positive one. I'd like to think that this is bringing people together. I'd like to think that it's helping people. I am the steward for these things called Little Free Libraries, and I've turned some of them into pantries. And I'd like to think that that's helping lots of people. I've heard anecdotally that it is. So, my hope is that out of this, we come out of it a stronger nation, a more unified nation. We come out of it a country that has innovative ways to help its fellow citizens, to educate, to imagine healthcare. And so I look at it as, all those people who have been sick and who have lost their lives, you want to hope that that's not in vain. And so to the extent that their lives have meaning, not because of the meaning those lives had when they were here with us, but also because we've learned lessons and we're going to do better and do more in terms of how we feed the homeless and how we take care of children and how we help those that are malnourished, then that's the very best that COVID-19 can do for us.
Hmm. Okay. What the last question is? Do you have anything else to add?
I would just like to add that I applaud you for doing this. I think this is fabulous. I think that to the extent that you are bringing information to people and you are an extremely aware and proactive person, that I think this is wonderful. And I say do more of it. And if I can assist you and be of help, I would be happy to do that. And I look forward to more wonderful things that you will be doing in the future.
Thank you so much. This was really great. I really appreciate